Okay, let me start. So good morning, good afternoon, or good evening, everyone. It depends on which part of the world you are now. And welcome to 7th EPIC webinar, and also the last one in 2020. I hope that 2020 that won't happen anytime I'm alive again. And wonderful, I would say a wonderful year for personal growth, because it was very unusual. My name is Bagatin. I'm a co-owner of Bagatin Clinic in Croatia, which currently has 120 employees, 2 locations in Zagreb, 1 in Split, and currently I'm also one of the organizers of EPIC, so European Patient Experience and Innovation Congress, together with our international presenters from Cleveland Clinic, Global Clinic Rating, and Stackpole and Associates. I'm happy to be the host of today's webinar with 2 great speakers, and I will also say my dear friends, so Dr. Claudia, Mika, founder and CEO of Temos International Healthcare Accreditation, and Daniel C. Shaw, from ambassador for the Global Clinic Rating. They will each have 20 minutes presentation on topic innovation and standards, conflict on convergence, and after that we are inviting you to increase the value of this webinar, which is recorded, by participating in Q&A sets. So after Claudia's presentation, we'll have time for 2 questions and more after Daniel. So duration of the whole entire webinar is planned for 1 hour. So let me introduce our first speaker, so Dr. Claudia Mika. She's a founder of and the CEO of Temos International Healthcare Accreditation, and she has been advising different associations together with the Bagatin Clinic, was one of them, and the governmental institution regarding quality-related topics, patient experience, and international patient management. Dr. Mika was also awarded the Dr. Sanjeev Malik Lifetime Award for the significant contribution to the development of the medical travel sector. It's one of the places on IMTJ. It's one of the places we met, and one of the reasons we work together. So in 2020, Dr. Mika developed together with her expert team a set of standards to help healthcare organizations worldwide to minimize the risk of COVID-19 transmission in healthcare settings. So I'm eager to hear Claudia speak. So Claudia, the stage is yours. Enjoy.
Yes, thank you very much, Onion, for the kind introduction, and thank you very much to you and the whole EPIC team for the invitation today to speak. So somebody needs to give me the opportunity to share my screen. And we have to see if you see anything. Now I have it.
Not yet, not yet.
No, now I have the function. I see it now. So, do you see my notes or do you see the screen of the presentation?
Notes.
We see the notes.
Okay, good. Then we change this. And now you see the presentation, right?
Yes, it's okay.
Great. So then good evening from Germany. Again, it's a great pleasure to be with you this evening or this morning for some of you about innovations and standards conflict or convergence. I would like to start with a few photos and images. So this was this year where we had an assessment in Greece, or colleagues had an assessment in Greece. This was only in February. So we had no social distancing yet. We hugged each other. We stayed together for the group photo, and nobody had an idea what is coming. And then just a week ago, this is Düsseldorf Airport in December 2020. This was our departure as a team to an assessment in Turkey. And in between, there was nothing. So we have empty airports. You see on the departure board that these are the flights for the day. We are wearing masks and a lot has changed. The same for the assessments. So as an accreditation body, we do a preparation, but then we do on-site visits for every single organization. And this is, at least at this moment, the new normal for us. This was last week in Turkey, so we wear FFP3 masks even, and our group photo is taking place not with a bad environment, but outside, and we had to keep the distance and we had to follow the measures to protect ourselves. Everything went well, but there's a difference. And what was in between, that's this virus, which affected, of course, all of us. So as an accreditation body, as I said, of course, us as well. And my first reaction was shock and panic. And I gave myself black hair for this photo. So that was, I think, the same for all of us, and not knowing what will come and what to do. So then the second reaction was, okay, yes, it's going to be hard, but hard is not impossible. And then we thought about, with the team, we thought about, okay, what do we have to do? What can we do? What should we do? And then we started listening to those organizations that are accredited by us. Like Onion said, they are one of our partners, accredited partners. So we communicated, we contacted our partners, said, okay, what do you need? How can we help? What should be done? And in parallel, we started to do our homework and the research. We had to learn about what it is all about. What is the news from CDC? What is the news from WHO, ISQA, and other reputable organizations? What do they publish? What can we learn? And what can we do? And then third, we had to make some decisions. And the first decision for me was, I want to prevent dismissals. I want to prevent termination of working contracts. So we want to keep our staff. And I know many of you who are in the same situation had exactly the same thought, independent that I'm coming from an accreditation body and you may represent a consultancy company or a clinic or a hospital. So that was my first aim and the decision. And fortunately, the German government helps quite a lot with this. We are very fortunate here and privileged that we can get some financial support from the government. And then we had to make other decisions. And of course, we stopped immediately all in-person on-site assessments for indefinite time. So our last assessment on-site was in March. It was in Greece. And there was, at that day, when we started with the assessment, they had the first confirmed case of COVID-19 in Greece. So it went well, we came back, but then I decided to protect assessors, healthcare providers, and patients, and we stopped everything. And of course, this had consequences, not only financially for us, but also with those organizations where we had already scheduled on-site assessment for the next weeks and months. So another decision was then made and said, we will not do virtual or hybrid assessments. For us, this is not only when we go on site and do the assessment, it's not only ticking or checking standards. It's not only a checklist. For us, this is communication, this is learning from each other, this is even consulting each other. And we said, no, we don't want to reduce this to virtual assessment. This can work. You can just check the standards, you can go with the camera, you can do everything. But the personal exchange, the exchange sometimes out of the records, the lessons learned, they will get lost. So it was a clear decision that we will not do this, and we didn't do this in the meantime. So this means that we had, of course, to get in close contact, that we had to communicate with all of our customers or the new applicants, and we postponed all accreditation projects to, we didn't know to when. So finally, we postponed it by 8 months, and we just resumed the on-site visits. So these were 3 main decisions I had to make. I don't regret any of them. I could take my stuff until now, and I'm very optimistic that this continues to the next year. And now, after all these months, I also think that these were the right decisions for the cooperation and the support of our clients and customers. Then we said, okay, what do we have? I mean, when we were confronted with this COVID-19 pandemic, and we said, okay, from our standards, from the Temos accreditation standards, we have hygiene and infection prevention standards already implemented. This means that we have policies and procedures on how to protect staff and patients from any kind of risk. They are implemented and they are there. We have trained staff, so we know that they are compliant to hygiene infection prevention standards already. We have a quality culture already for those organizations that are accredited by us. And we have monitoring tools already in place. So that's quite a lot. And second, we have disaster management and preparedness plans in place already, because these are covered by our standards. And I give you some examples in a minute. So this means our accredited partners should have been able to adjust instead of react in an unsystematic way. And we have clear responsibilities in such disaster management and preparedness plans. So this should have been available. We have committees or similar working groups which are responsive and much more. And I would like to give you just 2 examples for these standards for what we have. And I apologize for the size, but this is a screenshot from our standards document, which would be larger, bigger when you see it in original. So I will read it for you. I just want to give you an example though, hand hygiene processes. So one of our standards says that the implementation of the 5 moments for hand hygiene as published by WHO is assured throughout the healthcare provider. So, and then the 5 moments of hand hygiene are mentioned here. Our standard says that regular training on hand hygiene to caregivers is ongoing and documented. So, and hand hygiene is hand hygiene with or without COVID-19. It's the same hand hygiene. Measures, evaluation, assessment, and monitoring of correct hand hygiene are taken, and corrective actions are implemented. So even before COVID-19, this had to be followed and monitored, that people or healthcare staff do clean their hands. Information about the why and how of proper hand hygiene is provided to patients, relatives, and visitors. So, in accordance with the exemplary function, doctors support the education of patients and accompanying persons in hand hygiene and the importance of hand hygiene in the prevention of infections. So always we had not only healthcare staff, but also the involvement or the information of patients and relatives to support the healthcare worker staff for hand hygiene. And last but not least, for these hand hygiene processes, we have the availability of and access to hand disinfectant for staff, patients, and visitors is assured to support proper hand hygiene. So these are our standards, let's say, and which cover quite a lot. The second example I wanted to give you is in the direction of the disaster management and risk management. So our general standard says that the healthcare provider plans and provides a safe and secure physical environment in the facility through an implemented risk management. and respective auditing, inspection, and monitoring. Security measures are in place. And there's another standard saying or defining the emergency preparedness based on the healthcare provider's risk assessment and as part of the healthcare provider's risk management, as well as in cooperation with the local authorities, possible emergencies. And of course, nobody was thinking about a pandemic, that's for sure, but possible emergencies. And can any kind of disaster, known disaster, possible disaster, are identified, classified, and respective procedures and instructions are in place. So, having said this, again, the question, we asked ourselves, what do we have? And we said, we have quite a very good basis already to fight against the pandemic and to help our organizations that are accredited by us to get a plan or to fight against it. And then we asked ourselves, what do we need? And we said, we need some additional standards to fill the gap. And this was what Onion mentioned in his introduction, that we defined additional standards for or against COVID-19 to minimize the risk of transmission. And we sat together and we defined the objectives. What should these standards help for? And first of all, of course, to minimize the risk of exposure to SARS-CoV-2, that's for sure. But also to minimize the disease transmission to patients, healthcare staff, and others. And imagine we are talking about a time in March. So this was all defined in March and April. And we published our first set of standards in May. So at that time, not much was known about all this. So one of the objectives was also to identify the persons with presumptive COVID-19 disease and implement a triage procedure to assign the appropriate level of care. So it was all about safety first for staff, patients, and relatives. Then we want to help to prevent and break infection chains, to reduce the negative impacts on the emergency department, where an emergency department exists, and the hospital bed capacity. We wanted to help to maximize the efficiency of personal protective equipment, PPE, used to protect healthcare staff. And to prepare for potential staffing shortage. And I think this is an important point. Unfortunately, we know now today that a lot of healthcare staff was infected or family members were infected, so that we also a shortage of staff due to COVID-19. So this was the protection part, the preparation part for this point. And then finally, we said we want the organization's help to prepare for a step-by-step reopening and or an increase of patient numbers again if there was a decrease. And this was one of the points, for example, Bagatin contacted us very early and asked us, Claudia, you have contacts to Asia, and we know that, for example, in Malaysia or in South Korea, they are a few weeks ahead. So can you bring us in contact with some of your contacts there so that we can learn from their experience and that we can prepare step by step for our reopening? And this was one of the, let's say, points where we said, okay, we also have to do something and to put this as one of our objectives. For sure, we wanted to achieve a safe and healthy work environment for everybody working on the hospital and clinics, and to prepare alternative and supportive services to reduce over-occupancy. So these were our 10 main objectives from where we started to develop these additional standards. In the end, we had this chapter order and round about 60 additional standards covering the chapters you see, which was completely new, I think, on an international level even, is that we develop standards for teleconsultation and telemedicine services, and to fill the gap regarding disaster and emergency preparedness and planning, that we added crisis communication standards, which turned out to be crucial, the internal and external communication in such a crisis. We have annexes for dental settings, for reproductive care settings, where we have special conditions. We have a long chapter with more than 60 references referring to WHO, CDC, etc., etc. So where you can see where we base our standards on. So this was the result of our research within the Temos expert team. We thought that these standards, which are the first and only of its kind worldwide, should be free of charge for everybody. So until today, you can just register on our website, just with your name and your email address, and then GDPR conform and compliant, you can just download the standards free of charge. So we do not follow up, we do nothing, you can just download them. And we saw that it is used, so since May, when we first published our standards, the standards were downloaded approximately 170 organizations and from 40 countries on 6 continents. So they are used, and then, I mean, it's great. Crisis as an opportunity for those organizations who wanted to go a step further, we offer this certificate of compliance COVID-19 safe. So this is, of course, a paid option, including the access to online tools, to the review of compliance with our program standards in a virtual assessment. As I said before, our policy was not to do on-site assessments of hospitals and clinics anymore to protect everybody. So we had to find another way. And for these 60 standards, we found a very good desktop survey solution for the submission of evidence via photos, videos, documents, etc. And it works very well. So we have regular updates. At this moment, we have version 3.0. And we will most probably have another version in January or early February. What else did we do during this time? We tried to get prepared as much as possible for the new normal, not only for us, but also for our partners. So we reviewed all of our accreditation programs. And this means that the telemedicine standards and others are now also part of our regular standards. So when we talk about innovation and standards, so we put innovation from lessons learned where we were forced to learn. We put this in our standardized standards programs as well. We developed 4 eye care programs. We did some more work in our academy. So we gave web seminars informing about the COVID-19 situation. We wrote some articles, a book chapter. We gave regular training for our regional officers and assessors. And in October, we got to know that QHA Trent, our assessor, our accreditation colleagues from the UK, had to close their business. And since we have been in contact for many years with them, we offered them to take over those organizations who want to continue with accreditation but cannot continue with QHA Trent. And we offered that, and QHA Trent accepted this. So they recommended all their existing customers and clients to continue with Temos as an accreditation partner. So we have been communicating with these new partners. We explain the situation, we offer them to help them to take over, and this seems to be also quite fruitful continuation of the QHA Trent accreditation with Temos. Then, getting prepared for the new normal, we worked on our Temos Alliance. So for us, accreditation is not everything. We think that there should be network, there should be a broader alliance where our partners can get in contact, use the International Assistance Group preferred partner database to be listed there, to be found as a Temos accredited organization. We partners with IDO Healthcare, which is the leading organization when it comes to informed patient consent. We have an MOU with the Technical University of Deggendorf in Germany for telemedicine, digitalization and education, with the Euro-Mediterranean Institute for Quality and Safety in Healthcare for scientific programs and research, and 2 more are in preparation. So we try to extend our network to add value to all of our partners in the meantime. So finally, COVID-19 has changed healthcare now and for the future, for sure. Quick responses to the new and changing situations are essential to maximizing patient and staff safety, as well as minimizing risks. I think prepared is the new normal, so you don't have to get ready if you stay ready. This is, I think, we all learned. And when it comes to the question of if innovations and standards are a conflict or convergence, then I would say not only convergence, they get along very well. I think forced to be innovative, we were innovative, and we could clearly combine innovation and standards. And to give you another example for innovation at Temos, this is from this afternoon, brand new. These are Christmas cookies, and our IT has a 3D printer. So the baking forms for these cookies are printed with this 3D printer, and then our IT, Florian, a young man, baked himself for the whole Temos team, our Temos Christmas cookies. So a completely different way or explanation for innovation, but I wanted to share it with you, and I wish you all the best. I look forward to your questions later on. However, I want to wish you all the best for the new year. Have a good Christmas, Merry Christmas, and thank you very much for your interest and being with us today. Thank you very much.
Thank you very much, Claudia. And I would like to go to Daniel, but before, just one question that I got. It's because it says, what is your view on 2021? What is what will happen?
Okay, the crystal ball is here. Imagine
Yes.
this is the crystal ball. What will happen in which direction?
Yes.
For sure, we all expect the vaccination. So everybody is now hoping and looking forward to receiving vaccination. And I think this will change our world again to the next new normal, which will for sure not be the same normal we had before COVID-19. But we all hope that this improves the situation for all of us, so that we, instead of having nice web seminars, which are much appreciated, can meet personally at the EPIC Congress in 2021. And I very much look forward to see these new developments happen.
Great, great. So thank you very much. We'll continue later with the questions. Now I would like to get to my dear friend Daniel Shaw, and he's our frequent host on EPIC webinars. For those who have followed us before, and they may have noticed, he's an enthusiastic storyteller full of practical ideas. Although he's gonna talk about data, he'll do it with a smile. So Daniel works closely with this portfolio of leading private clinics, improving the way these clinics and hospitals reach, book, and engage patients to increase their reputations and results. So he's full of knowledge, so use that. So the patient innovation trends Daniel shares are always supported with insightful data, with a smile, and facts gained through the past 4 years as an ambassador of GCR, so Global Clinic Rating, an award-winning initiative co-founded by an employee of Google to enable both patients and healthcare professionals to compare the apparent quality of almost 500,000 of private clinics and hospitals worldwide. So Daniel, I can't wait to hear what you have to say. So please, the floor is yours. 20 minutes so we get some time for questions. You're on mute. You're on mute, please.
Unmute. There we go. So, thank you very much again for bringing me to the EPIC webinar. I'm really privileged to be a part of this community. And those people I know who are not presenting or have not taken part on the webinar directly, I've just looked at the participants list, and I can see a lot of names that Ogyen, I, and Claudia know. So for those who know us personally, we give our sincere greetings and thank you for your time and attention in joining EPIC webinar month after month and supporting it, even though we cannot meet you in person. Thank you so much. For those of you who don't know me, yes, as Ogyen said, my name is Daniel Shaw. I run 2 small dental clinics. I help increase the reputation, revenue, and results of multiple, well, it's actually hundreds now, of private medical clinics around the world. And I'm very enthusiastic about new medical trends, especially in the sphere of patient choice and patient access. So I work closely with companies like Google, Microsoft, and IBM, reading the blogs, going to the conferences, attending all the webinars to try and keep up to date as much as possible. So I do hope that something about what I will share right now will be practical, will be entertaining, but it'll be something that will, open your eyes slightly to what's happening despite COVID and everything around, or what's happening right now with patient choice. Now, hopefully, I'm going to try and see if I can share my screen by clicking here. There we go, share. Right, guys, please do confirm if you can see my screen. Yes, can you see? Great, okay, super. So the future of patient choice. And let me go, click. So, of course, patient choice is evolving more than ever before. But before we look at the future, it might be worth go back, into the past to see actually where we came from. So 200,000 years ago, when Homo sapiens appeared on this planet, and I'm not sure if you know what Homo sapiens in Latin means, the wise man. The wise man realized that he had a need to heal himself. And archaeologists, this is interesting for us because archaeologists have found artifacts and proof that this Homo sapiens was trying to heal himself by collecting leaves, testing out constructions to ail his medical problems. And if we speed up that, to 20,000 years ago, when we entered a time on our planet, which we look at theism, when to solve our medical needs, we prayed to the gods and looked to nature and natural sources and mystical sources to try and heal our problems. And this is very interesting that even till today, people are still looking, healing themselves and praying to the gods, and moving now, of course, 2,000 years ago into the stage where we looked to humans to heal our medical issues. And we entered a stage of life called humanism. And the most important part for us now, as we're dealing in EPIC, and one of the reasons certainly why Ogyen and Irving and the rest of us, and Cleveland Clinic and the rest of us behind the EPIC project, was to introduce what digital has actually brought to patient choice and patient safety around the world. And we entered a time called dataism, where patients, along with looking to the gods, to humans and themselves, look towards data to make a choice of healing or a medical solution for themselves. Now, for the next 5 minutes, I'm just going to just look at how many industries that have actually passed through this change, who have gone from zero to mass adoption in the digital sphere. And very typical one, though not applicable at the moment with travel choice and COVID in 2020. But in 2000, less than 1% of people actually looked online to discover a way to travel to another place. And you can guess what's going to be the number. In 2019, it's now actually 96% of people around the world using GPS, travel engines, checking the bus timetables online, checking flights prices. All this has made it into a mass adoption of data. And travel agents, as we know, are very slowly out of the picture. Another example would be book choice. And straight away comes to mind Amazon and Jeff Bezos as his first #1 go-to market. He thought that the future of book choice, when he discovered the internet, would have a mass adoption. And of course it did. The Amazon report in 2019 brings it up to 51% of all books which are read today are researched or bought online. A good one here, dating. So even affecting relationships. So people finding partners online, almost non-existent in the year 2000. But today, actually 37% of new marriages are through couples that joined together online. And amazingly, China is racing ahead in this. 52% of those marriages which are happening, in China. And I can go on and on and on about industries which have actually been replaced by this digital era. But we're here to talk about healthcare. And funnily enough, right at the beginning, when the internet, came to mass adoption, healthcare choices was one of the #1 searches, after the obvious ones that we don't talk about, about terrorism or porn or gambling and so forth and entertainment. But healthcare, 18% of searches at that time were actually made. Today, that's reached 81%, 2019, which now, what I wanted to say here very simply is that my obvious advice, of course, in leading a seminar, you might think that you need to be visible online, okay? You need to build a website or you need to get Google reviews. That would be a topic which I would have talked about 20 years ago. So if you saw any of my first seminars, and that's what I'm talking. What I'm talking about today, though, is something quite different, because I believe in 5 years' time, and this is the trend, and I'll explain a little bit more about this, that it's really happening. Healthcare will become actually not our choice at all. Okay, and I'll be going on to talk about just a moment into transhumanism, the age of AI recommendations. And you may think that this is quite futuristic, that AI recommendations, it's not something that my consultancy company or my hospital or my clinic is even dealing with or thinking about at the moment. But you'd be surprised that how much you're actually using AI recommendations multiple times a day already. When we use Waze or Google Maps to get somewhere, it's an AI recommendation of a way to get to place. If you go to YouTube, there'll be the recommended videos. If you open your Instagram account or go to Amazon, there will always be those recommended products based on what you've bought previously or looked at previously. Also, Facebook, LinkedIn, and also on Instagram more recently, who should you connect with? AI is everywhere, and it's only a very, very fraction away before it actually hits healthcare, big style. So this is what I'm really, excited about sharing with you. And here, if you have a look at this image, this is the percentage of people who are actually using healthcare AI systems. So it's digital health technology or mobile health apps, which are recommending them not particularly a doctor or hospital at the moment, but some type of medical intervention. And you can see, just look at these numbers, mass adoption throughout the world. And the countries which are racing ahead, of course, you think like US, UK, Australia, and so forth. But look at this: India, China, Saudi Arabia, Russia. How much people are now not relying just on digital to make a medical choice, but actually the choice of artificial intelligence on where to go for a doctor and also what treatment to actually have. Now, I'm not sure if any of you are aware of the term GAFAM, there are obviously Asian equivalents of these huge technological giants that are racing ahead in the AI industry, and their first point of call, of course, is going to be AI in healthcare. But GAFAM, which is Google, Amazon, Facebook, and Microsoft, and let's just quickly, before I go into all their projects, just the obvious one that comes to mind is Google and working with Google DeepMind. And this is the slogan. If you ever go to the Google Health website or Google DeepMind, of course, AI will enable everyone on the planet to live their healthiest life. Okay? Let's look at Amazon. Healthcare built around you is the slogan of their AI introduction into Amazon Care. Here's one from Facebook, bringing the world closer together through advancing AI. Okay? Apple. The future of healthcare is in your hands, and literally they focus on devices that can actually guide you to make better healthcare choices. Okay. Microsoft, better experiences, better insights, better care, of course, through AI. Now, these are all, if you could actually apply these sentences, especially this last one, to a lot of hospitals and clinics as a slogan. And there are other companies that I didn't mention here that are racing ahead to be the first to market in AI recommendations for healthcare. Okay. Now, the audience I typically deal with on these types of webinars are typically much older than me, and they see this possibly as some type of threat to the healthcare industry. But I do not see it as a threat. As threat, I say it as an evolution. We have moved, from that stage of looking to ourselves, looking to the gods, as I mentioned, looking to humans, looking to data, and this is the next evolutionary step. And as you've seen of those numbers I presented, they're just getting faster and faster and faster as the scale of adoption rises and rises and rises quickly. Just like if you check Bitcoin the past few days, you've seen it's done another mountain, and it's arrived, and I believe also cryptocurrency will make a big difference in healthcare. But this is an evolution, and it's not something really to be afraid of. But just imagine now, I just want you to imagine for a moment, what would you feel if you saw the internet happening actually before it did? Now think back to those days, pre-internet days when we were watching, VHS cassettes and going to the video shop to hire a movie and pulling out our maps as we were driving the car so we didn't get lost, and asking, of course, doctors for recommendations to which hospital clinic to go to, and not having any other source to verify if they were, worthy of our attention or not. Now, when Jeff Bezos from Amazon at that time heard that the internet was happening, he opened up the shop of all things. That was his big project. And think back, what would you do if you actually saw the internet happening before it did? Would you have made your hospital or your clinic or your consultancy on the internet and push that forward to gain an advantage? Would you have done that? So the same question I'm asking you today. So we are at the verge of something massive happening, and the same, how would I say it? Same transformation that the internet brought to the world will happen also now through what we call artificial intelligence. We are right at the beginning of it, and you have been on this seminar, on this webinar at Epic, and it's going to happen. So big or small, I run a very small medical practice. It's compared to some of Cleveland Clinic or some of the big clinics that we talk to through Epic. We might seem very irrelevant, but I want to be ready to be recommended through AI when it's happening. So, of course, just as a small practice, I've been optimizing all the text on our website so that it can be found by Alexa, by Google Voice. I've been optimizing all the information around our clinic so that it can be found and used by AI. And no matter how small or large you are, this would be my practical advice, okay, is to collect outcomes. Number one things, collect the outcomes of what you do, and secondly, publish those outcomes. Without data, points and available on the net or on the intranet. The AI cannot work with, or the key here in this early stage is recommend your medical facility. It cannot recommend your facility if there's no data. And the more quality and the more transparent that data is, the quicker you will be found. I spent a little bit of time in my life also optimizing, websites so they appear Google before, these Google AdWords appeared at the side. And I really was like 10 years ago, so easy to rank #1. It was. Today, I don't know whether I put my attention on trying to do that. It's so complicated. But this will be the same at the beginning of healthcare recommendations. If your data is available, you can actually be found quicker. And the great thing about also collecting data, you can innovate faster. Okay? So this data will not only help you be more recommended, but of course it helps you improve. And there's so many hospitals and so many clinics and so many companies around the world that are still ignorant of collecting the outcomes of what they do and actually publishing it. That's my key takeaway. If you'd like to connect with me and ask me any questions, you can connect with me. My name is Coulton Shore. And I'd love to hear your questions if you do have any. This is a very different theme, but I really wanted to take you away from the COVID style thinking of where we are right now, but what will happen, in 21, 22, despite what happens with COVID. Recommendations and AI, AI recommendations are the latest new thing. And let's make sure that your companies and your clinics and your hospitals are ahead. Thanks a lot.
Thank you very much, Daniel. And I would start with the same question as with Claudia. So, what can we expect in 2021? So, and how to deal with what's going to happen? So we adopted. What now?
Yeah, so of course, no need to mention it. Digital adoption has rapidly increased. It's been brought forward not 5 years, but possibly 10 years. When people talk now today about Zoom, it's a common word. Whereas, a year ago, it wasn't even heard of. And also fantastic for us as in this field is telemedicine. Thinking about telemedicine, a couple of conferences ago, we were still talking about telemedicine as a new thing. But now it's really is commonplace. So what will the future hold? This will be AI recommendations for sure. And I come from a dental background. So there's a device, maybe many of you know it as well. It's called Invisalign. It's like Claudia's cookies. It's 3D printed in the US. It's not handmade, and it's shipped to all the dental clinics around the world that want to straighten people's smiles. And the thing with Invisalign is that now there's software that can actually diagnose a patient's smile from their home much better than a doctor can. But because of laws and regulations, the doctor, first of all, has to just open that software, see what the recommendations are, AI recommendations, and communicate that to the patient. So this is just in dentistry alone, and in other industries which are much more complicated than moving teeth backwards and forwards. Heart surgery, brain surgery, AI is massively coming forward. But what's going to happen is that's actually going to come into our homes. That's the difference. Rather than it being now in the hospital where the doctor is communicating that information to it, I believe that more and more patients will have access themselves to that data, and then they will be able to make the choice of where to go and how to go about getting treatment.
So you're talking about more of a patient engagement is going to happen, which will help definitely in the future. So Claudia, I got a question. Can you there's a question. So how will digital transformation change the standards in clinics and hospitals, especially what you are as an accreditation body reach for? And will digital transformation increase patient experience? How? It's not an easy question, but this is something that is here. So I'm very glad that Daniel mentioned that it's here. It's going fast, and the most the biggest problem, it's cost a lot of money to hospitals. So it's a lot of issue that we need to deal with.
Yeah, but Daniel already answered or mentioned a lot of points when it comes to our daily work, when we see during the last years about digitalization. So one example is, which has an influence on standardization is, for example, maintenance and servicing for CT scans, for MRIs. So nobody is coming to the hospital anymore. It's all done from remote. So this is one example. And our standard says that the devices are regularly maintained and serviced. So we don't care, in quotes, if it is done from remote or if it's done on site, but it's fact that it's more and more done from remote. So this is one example. The second example we had before, and Daniel also mentioned, I mentioned it before, now with COVID-19, we were forced to think about telemedicine. It was not accepted before, neither by most of the patients, let's say, but even worse, by the doctors. And now doctors were forced to use telemedicine, to use the Zoom and all these tools also to get in contact with the patient. And now it's accepted. So it's another example for digitalization in a different way. So and it will continue. This is good. So definitely.
So,
and we, sorry to add this, and we, of course, as an accreditation body, we have to adjust our standards according to the new normal, which means digitalization as well. So this can be the good thing in GDPR and data security and all this kind of stuff, where we have added standards this year, and maintenance service, as I mentioned.
So now the question for Daniel. So will digital transformation increase patient experience, and how? Because I think this is something that we all want to know how to do it. Please.
Okay. Will it increase? So there's two ways. There's two ways which I've actually seen in practice. I've seen the digital transformation actually decrease the level of patient experience. That people are relying on, people getting messages or no messages at all, on people talking to iPads instead of humans. On the other side, it's a great opportunity if the clinic knows how to use it right. The messaging and touch points. A very quick example, I'm working with a clinic now in Egypt that is sending, over 10 messages from the time that someone starts treatment to the end of treatment, but it's all scheduled digitally. So even if their staff forget to follow up, it's done, and they can collect those patient outcomes over time and ensure that the patient is on an increase, getting an increasingly better experience. So I think there's two sides. There's one way and that's an advantage for clinics. They can step up now their personal interaction game as other clinics become actually more digital, but not forgetting on the other side to actually use those digital tools, and for example, being recommended to your full advantage now that they're available.
So we all know that the health is usually slowly adapting. I'm not sure that health is number one in being first in anything digital. Yeah. So how will it look in 10 years? So my question is how to finance all this. I think this is going to be the biggest problem, because everything's going faster. How to deal with it as a hospital? So you guys usually travel all around the world. So you have the biggest knowledge from anybody I know. So what can you say to the clinics, hospitals, health workers? So how to deal with this fast world and fast expenses?
Claudia, do you want to go in?
I want to leave the floor for you. I can just give it. I'm not the technical expert, so I think from this perspective, Daniel, you have to answer this question. From my experience, I would say not every development which is available is needed to be implemented at any part of the world. So, for example, based on your cultural background, based on the region where you are in, it may not be accepted, the implementation of any kind of digitalization, which may work in other parts of the world. So we know, for example, South Korea is very advanced in use of technology. People may accept to talk to a robot instead of a physician. If I go to Germany, I cannot imagine that we are already at that stage that we would talk to a robot instead of a physician. We got used to talk to our physician via web platforms for teleconsultation because of COVID-19. So I think you don't need to take any new technology, and you don't need to invest in any, because it may not make sense for the patients and the environment where you are in. So that's the practical or the cultural related thing. And Daniel may add technically what makes sense or what not.
Yeah, so I just envision it about 10 years from now that you would simply say, you know, your device, you wouldn't even ask your device for a medical opinion. It would say, you know, your device would tell you in the morning, you know what, Daniel, it's time for you to go for a diagnostic check, for an MRI, because it looks like you have symptoms of, and then we go for the MRI, and then just like Claudia said, possibly there would be a robotic, you know, system that would say the MRI says that the results are this, 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 and this is the recommended treatment. And so you book the recommended treatment on your phone, still with no human interaction, and then you go for that treatment. And it could be, that treatment could be done robotically, you know, which it is in many, many cases now around the world. Whether we want that or not, I believe it will happen, because what is easier, more efficient and safer, you know, for us will happen, you know. And that's happened with all the industries that I've actually, you know, mentioned in the presentation. That nobody really thinks about now about, you know, going to Blockbuster, to the video store to hire a film, you know. Even though that interaction, that personal experience was fantastic, maybe it was. But it's much easier just to sit and open Netflix and have Netflix now recommend, tonight I recommend you this, because you watch this, you know. So this is the future. How to fund this type of thing. I wouldn't even think about that. I would just think about making sure that I'm ahead of that trend. Making sure that I have the data available, as much data as I can, because I know that data is going to fuel these recommendations and these advice. And if I'm going to survive as a medical practitioner or a successful clinic, I need to be plugged in to these things. I need to make sure the machines are on the intranet and that they're communicating with each other and communicating this data also to patients, so they can make a fairer, safer, and more informed choice, as I like to say professionally.
Great. And for the closing, so 30 seconds closing note for Claudia and then Daniel, and then we'll say goodbye to everybody. Claudia, please.
Yes, again, thank you very much for today's invitation. I hope I could contribute to the topic. I think most of the things are said, so just to repeat that I wish everybody all the best for the upcoming year, for the season, and that we meet each other to discuss these things and others personally next year.
In person, yes, for sure. Daniel.
Thank you very much, everybody, for joining the call. Thank you, Ogien and Sarah and the team for putting it on. And my slogan for today is act now so that you can stay ahead in the future. That's what I would leave it with.
Thank you everyone for following this epic journey, and I got a lot of information from you guys. I always get more than I wanted, and I'm sure it's gonna be a dynamic year, and next 5 will be different than ever before. So looking forward to them, and this whole epic webinar is recorded, and we can watch it again later. Thank you very much, and on behalf of Epic team, I wish everybody a happy and blessed holidays and a successful entry into new 2021. Wish you all the best, and I hope I see you soon.
Yeah.
Goodbye.
Thank you. Thank you.